Thank you so much, Tina, for this opportunity. My name is Virginia Kroger. I am the program manager for HICAP San Mateo County. HICAP stands for Health Insurance Counseling and Advocacy Program. And that's why we go by HICAP, because it's a lot to say in one breath. But we are a counseling program that is a state and federally funded program. And we do so, we give counseling services on a free basis, one-on-one and unbiased. And unbiased meaning we provide all of the information available for different plan choices, penalties, premiums, all of the information that we can gather to provide to the clients. And then we advise them about what can happen when they choose one thing over another. But as far as them making the choices, they make the choice themselves. And it's one-on-one, it's confidential, and our counselors are certified by the state. So they go through a very rigorous training on Medicare policy and plans, and it changes all the time. Every year we go through a review and a training for the updates. And it's a way for people to know that they are getting counseling that is not going to line the pockets of someone like an agent or a broker. And there's nothing wrong with an agent or a broker, but going into it knowing that maybe you ask us for our unbiased information and then you go to someone that you trust that can actually enroll you in something. And that's how we kind of advise you to do that, because we won't sell you a policy. We don't recommend anything. We don't say one is better over the other. So Medicare can be very confusing, and there are a lot of nuances in how it's handled, whether it's you're leaving a job, you're turning 65, you've been working and you're past 65, even for those who are on Medicare and Medi-Cal. There are so many pieces that people don't realize can work together, but they can also work against you if you don't know how to make it work for you. So we're here to help you do that, make it work for you. And today, I wanted to just give you just a taste of some of the things that we do. We do presentations on everything from open enrollment in Medicare to this one today, Medicare fraud prevention. And we also do general, like new to Medicare type presentations for people, because it is quite a transition for people. So today I'm just going to go through a presentation that I've been doing around the county, and feel free to ask questions. And please, Tina, if I miss someone raising a hand, please interrupt me.
Okay.
But basically today, wanting you to know about Medicare fraud prevention, mainly because maybe some of you aren't on Medicare yet, or maybe you are on it and you're satisfied with your coverage. And we're sort of in a waiting period right now. We're waiting to go into open enrollment. So there's not a whole lot that people can do in this downtime, but this is the time to be thinking about protecting your Medicare information, because as you go into open enrollment, just like any other season of high phone calls, high emails, a lot of mailings going out, it's a prime time for people to be misled and to be taken advantage of, maybe change their coverage and not even realize what they've done. So I want to advise you to be very careful from now through the end of the year, to keep yourself from making choices that you don't fully understand the consequences. And we're here all the time. Well, during the week, we're here. And I'll definitely give you my phone number at the end, and you're more than welcome to call me anytime. So I will begin this with the, hopefully that I have to open it as a slideshow. That's what I forgot to do. I'm sorry. This is just not working out very well here.
No problem. Yeah.
Oh, okay. So I need to make it a slideshow first. Give me this second here. You have been so patient. I appreciate that very much. I will find it, and then we will begin. As you can tell, I'm someone who has a lot going on. And that's a good thing, but it can also be challenging. Okay. Forgive me, forgive me. Now I can't find it. Somebody say something, please.
Do we have any plans for the weekend? I'm looking forward to
But,
my Portugal trip. I have a Portugal trip planned in August. Have you guys been?
oh, oh no, but I've heard it's beautiful.
Yeah, heading to Lisbon
Love
and
it.
Porto.
Oh, I would love that.
So the funny thing is the last 4 days I just planned it without planning anything. No hotels. It's, oh, we'll figure out what we like and then get the hotels for those last 4 days.
I I know it's in here. I'm so sorry. Give me a second.
No problem. Yeah.
I It's one I'm actually doing over the weekend at the San Mateo Senior Center
Mm.
with Assembly Member Pappen, Diane Pappen.
Uh-huh. Oh, wow.
And so it is, I can't find it. It disappeared.
Uh, do you have a Mac?
No, I have a PC and um, I'm okay. You know what I'm going to do? All right. What I will do instead right now is I will go over a couple of the scams that we're seeing that are pretty prominent. One of them is actually the Medicare card scam. I don't know if any of you have heard of it, but it is. Everyone is going around telling you that your Medicare card needs to be updated because the red, white, and blue paper version is no longer valid. And that is untrue. That is blatantly untrue. Um, what we are finding is that people are telling beneficiaries like you that um, it is, you're going to get a plastic card, you're going to have this new card with a new number, a new logo, and it's just not the case. It's not the case. All right, now let me share this. Where's my share button? Did you give me the share button again? Here we go. All right.
Sure, it's gonna be.
Okay, can you see it now?
Yes, we can see it.
Okay, and now it's still not advancing. I don't know why it's not advancing. I don't know. I'm so sorry, everyone.
No, no problem. You can just maybe you can talk through it. It's okay. Yeah.
I will do that.
Mhm.
Okay, so we talked about Medicare cards. The Medicare cards that you know are valid are the paper version, card stock, paper, black, red, white, and blue with the eagle on it. That is your valid Medicare card. If someone tells you that you need a new card, that it's we're laminating them, we're going into black and white, it's wrong. They are trying to scam you. That is one of the basic scams. And one of the things we tell people is don't bring your Medicare card with you everywhere. Even if you think you need the coverage to show a provider, they can find it after the fact. They don't need to see your card every time. And it's a thing that started out as a scam tool for people, because if you remember, before 2018, they had your Social Security number was on your Medicare card. And after, people found out that, oh, you can use that to, literally get Social Security, anything with your Social Security number. Then they took that number and they replaced it with what you have now, which is just a random alphanumeric number. It has letters and numbers. But now even that is vulnerable to people who want to misuse it. So that's why it pays to attend things like this that are timely when they work, when the presentation works, timely, so that you can stay up to date on things that are happening. There's also, if any of you are on Medicare right now, anything that has to do with free medical equipment, durable medical equipment like a wheelchair or a walker, even canes, maybe a CPAP machine, anything like that. Those items are easily over-ordered and used as a way to boost someone's billing, upcoding, and billing higher amounts than what are actually needed or even necessary. So be aware that when your doctor orders something for you, that you need to make sure you're checking your summary notices and make sure that that reflects exactly what you did get and what you were supposed to get. One of the other scams that's really very difficult to talk about is hospice enrollment scams, which are probably the lowest of the low for people to exploit hospice for people who really, really need it. It's a benefit in Medicare that is probably one of the most expensive ones, and it is the most needed when it's necessary. And people have been using it as a tool to gain access to your medical information, your Medicare numbers, so that they can add certain services or add on equipment onto your bill that you didn't need or order. So we recommend that you keep very close watch on your Medicare summary notices, which are the quarterly bills. They're not bills in the sense that you pay something, but they're a statement of your coverage in the last 3 to 4 months. So if you've had an appointment, if you've had a lab or a test, you're going to get a summary notice in the mail. Now that summary notice, look at it as though you would look at a credit card bill. A credit card bill where you're looking line by line to make sure that the date that they have listed is the date you went to the doctor. That doctor is your doctor. Look at it carefully, because it's one of those things where people can add on a lot of little things in a lot of places, and all of a sudden your bill or your statement is inflated beyond what you should have or expect. And the problem is that if you're not checking it, there's probably many people in Medicare that aren't checking it either. And that leads to fraud like this being widespread. We have a lot of people that call us that find these erroneous charges on their bills, on their statements that they know are not right. And in that case, what we do is we take down the information. We ask them to make a report to us and or Medicare to alert them that their number has been compromised. Also, there's the Senior Medicare Patrol, which is sort of like a partner with us, and it is a program that's run countrywide, and they are they specifically focus on preventing Medicare fraud, because this is if you can believe it, $60 billion a year estimate that this one program has been targeted in fraud and scams. that is a lot of money, and that's just one program that has nothing to do with any other kind of fraud that you might hear of. And I think it's because, one, they're targeting people that are more trusting maybe, or have come to expect their coverage to be there for them, their providers to be stable and trustworthy. And they're people in this generation that like interacting with people one-on-one. They interact with them on the phone more often than on email or on a website. So you pick up the phone, you're talking to a live person, and a person in an older adult that is maybe at home and homebound, or taking care of someone who is, they value that connection with someone. So the person that's committing the fraud is exploiting that feeling of loneliness and alienation as well. So we've found that with Medicare, many of the scams are perpetuated by phone or in person. So it could be someone that you meet, you're in a shopping mall, you're going to your car, and there's someone that's kind of hanging around the parking lot. They target you. You have a cane, and they come up to you and they say, you look like you could benefit from a wheelchair. You're kind of struggling here. Can I put you on this list, and we'll send you a wheelchair. Medicare will cover it. So you're trusting, and you give them your information. You give them your Medicare number, your name, and your address, your date of birth, and then you wait. You wait for that wheelchair, and that wheelchair never comes, because that person was using your disability against you, and your trusting nature against you. So we found that where a lot of scams now are more into social media, they're on a text line. We have found that more and more in Medicare, it's actually by phone and in person. So I want to encourage you, if you're ever in a situation that hopefully just doesn't feel right to you, you get a sense that there's some problem, this person is telling you that Medicare will cover it. No, don't worry. Just remember, Medicare is just like everything else. If you want a service, you have to provide the right information, and you have to make sure it's medically necessary. And these people that are doing this are not at all concerned at all about you and what you really need. We're here to help you decipher if it is indeed a scam, or if it's just it could be just a mistake. Sometimes there are mistakes that are made. The other thing that we have found, and this is disturbing on a different level, oftentimes with fraud and those things that you hear about in the news, a lot of it is either with someone you don't know, so it's an anonymous contact that reaches out to you, or it's someone who has befriended you somehow. It doesn't have to be a friendship or a romantic interest. It could just be someone tapping into that loneliness that you're feeling being by yourself, or being with someone you're caring for at home. And the Medicare fraud often is a network of people that are working together to defraud. So it's not just a lone person or a couple of people.
Brand new car, yeah, the insurance is higher because it's more than
actually the people that
so bought a used car
in your network
can go up that much.
In your network that are working together. So it could be a doctor, it could be a pharmacist, it could be a lab technician, it could be a nurse, it could be a hospice worker. Anyone that is in a network of a chain of care and charges, and there's a lot of different people that are filtering into your coverage, your Medicare coverage, and any one of them could be part of it. They could all be part of it. There's some scams out there where billions of dollars of networks that are affected. So that's very general. But if you have any questions right now, I'm happy to take some questions. I hope I haven't talked too long and gotten you kind of out of there. And I'm sorry about my presentation not loading here. But you're more than welcome to. I will send it to Tina if you'd like, and I'm sure that she could get it to you if you'd like that as well.
So I have a question, Virginia. If we need help, if someone needs help, can we send them your way? And can you, or does it have to be San Mateo County residents?
Well, that's a good question, Tina. Actually, San Mateo County residents, yes, we can definitely help them. If they are outside of San Mateo County, they would call the 1-800 number for HICAP,
Okay.
which is 1-800-434-0222.
Mm-hmm. Okay.
And if they have a 650 area code phone number, we will probably get them. Even if they live elsewhere, we can always get them the HICAP in that county.
Great.
HICAPs are throughout the county, throughout the states, as well as county level. So we can find you the correct HICAP. It's all based in where you live.
Great.
But a lot of the principles, we understand we can share those universally. It's just the plans themselves that are specific to each county.
Yeah, and question that one of my friend had was, what are the advantages and disadvantages of the original Medicare versus the Medicare Advantage?
Okay.
Do you have a quick overview of those two? And
I do. I just can't load my slides, but I know it by memory. So original Medicare is what was around first, of course, and that is the fee-for-service. That is the original federal program that was developed in 1965. And that consists of Part A, B, and now D, as in drug. Part A is the hospital insurance. That's primarily inpatient care. It can also be hospice, some skilled nursing. It has very specific things that it covers. And that is Part A. And that's primarily also what many people get premium free. When they have worked a minimum of 10 years at usually 40 quarters of service with Social Security, typically they will get premium free Part A. So a lot of people will, they might enroll in that when they turn 65, and it doesn't cost them anything. It's just they've enrolled. Part B is the second part, and that's medical insurance. That's the part that covers outpatient care, primarily doctors, labs, anything that's related to outpatient care. And it's usually the part that people postpone when they're working and they're already covered under an employer plan. So many people will turn 65, and if they haven't enrolled in A and they're still working, they might delay enrolling in Part A and B until they are either retiring, their employer plan changes, something significant happens in their situation, and they realize, okay, I need health coverage, and Medicare it's not cheap, but it's maybe more affordable for some people than an employer plan at times, or a retiree plan. Part D came about in 2006, I believe, and that is the drug component. That's the newest part to Medicare, and that's also required. So original Medicare is A, B, and D, and you need all three. Medicare Advantage is Part C. And the advantage, as we say in quotes, is the, not that it's more advantageous, but it is an alternative to Medicare in the sense that it has everything rolled into one plan. So instead of saying, I have A, B, C, and D, most people say I either have original Medicare and a Part D, a drug plan, or I have a Medicare Advantage plan that has drug coverage in it. So Medicare Advantage has all of the parts. It has A, B, and D, but it's considered a network-based plan. So something like your HMOs or your PPOs, those that are primarily network-based.
It was Madden's address. College, what College Avenue?
And so those two, they're distinct. And it's one of those things where people often get confused, which one do I have? The main thing to remember is you can't be in both at the same time. So people during open enrollment, they will switch from original Medicare and Part D over to a Medicare Advantage if they want to do a network-based plan. Now, for people that travel a lot and maybe spend a lot of time elsewhere, we usually recommend that they go with original Medicare because that covers them for coverage anywhere in the United States. So you can be in one state for half of the year and have your doctor here, and then you can go to another state for half the year and have a doctor there, and you're not losing coverage, you're not and you're not doubling up. You're just spending your time in two different places. But if you had a Medicare Advantage plan, that plan is specific to that network. It's like a Kaiser plan or something where Kaiser's here, but maybe Kaiser isn't in the Midwest or the East Coast. But Medicare is. So if you're someone who travels a lot or spends time elsewhere a lot, we recommend maybe that you consider the original Medicare side. The advantage of original Medicare as well is that there is a way to sort of fashion your own healthcare. So you have the Medicare part, the A and B. You can get a Part D with a company, a standalone drug plan. And then you can also supplement that with what we call a Medicare supplement. It's called a Medigap. And it is a separate policy that covers that 20% of costs that Medicare doesn't cover. So many of you probably know that Medicare covers 80% of medically necessary services, but that 20% is your responsibility. Now, if you don't have a Medicare supplement and you only have Medicare and a Part D, every time you go to the doctor, every time you go to the hospital, every time you get a test, anything like that, you are going to pay that 20% of that service. And that number, there is no maximum. That number can be astronomical throughout the year. You could be in the hospital several times and pay that hospital deductible several times in a year. If you have a Medigap as a supplement, that is a separate policy, and that has a set premium. It has set copays, and you know exactly what you're going to pay based on your coverage. That is one advantage because you are paying a set premium per month, not a 20% of some number that you don't know what that is. And the Medigaps they're private policies, and all these companies offer them. So you can shop around. You can find one that's within your budget. You can find one that you can afford, that you like, that you trust, and you can take it with you. You can take it to your other home in another state. It covers you. And it covers things like the hospital deductible, the first few pints of blood if you need it, skilled nursing care, hospice care, a percentage of that. And every plan that is offered, they're standardized, meaning that they offer the same benefits within that group of plans. So you have a group plan that's under the letter N for Nancy, say. Every plan that has a plan N, every company that has one, must cover certain things. And that's one of the things that at HICAP, what we do is we provide you with that kind of information so that you can literally look at the list and you can say, okay, well, half a dozen of these companies offer this plan. I like 2 or 3 of them. I'm going to call them and find out what their rate is, what their premium is for my age group and my area where I live. We have a chart that we put together for people, and it covers these things. So everything from, like I say, Medicare Part A coinsurance for the days you're in the hospital, pints of blood, Medicare Part B coinsurance, everything that you would pay would be covered under these plans. And for those on original Medicare, it's a big help because they're paying the Part B premium already for Medicare, and then they're paying a Part D premium for drug coverage, and they're paying for a Medigap, but the Medigap has a premium attached to it. It's not going to be this number that can change, that there's no max. On the flip side, one of the advantages of Medicare Advantage is there is a maximum out-of-pocket cost. So per year, you're going to know that you're not going to pay more than a certain amount each year. And each year it goes up a little, just like everything does, but it has its own protection. Another advantage of that is that you don't need, you can't be turned down. You can't be for any pre-existing conditions. If you're in poor health and you're worried about getting on Medicare, a Medicare Advantage plan must accept you. They cannot reject you. Medigap, in original Medicare, they can if you are outside of an enrollment period that is protected for you. So there's a lot of nuances there, and that's where we come in. We help explain how it works. So I hope that answers your question, Tina. It might have been a little long, but the main thing is to remember is that when you have Medicare, it means that you have hospital and medical coverage and drug coverage. You have to have all 3 of those. How you have it, how you get it, is up to you. You can either do the original Medicare side of the road, or you can do a Medicare Advantage side. And the many differences, there's a lot, but those are a couple of the big ones, is travel and access to care and acceptance. A lot of people worry if they're in poor health that they'll be left out in the cold, and that's not the case.
Right. Okay. Thank you so much.
Thank you. Are there any other questions of the attendees? I'm just so sorry about my presentation. Put it in chat. Is there someone in chat here? Let's see. It is complicated, Gary. Yes, definitely. Let me just so as we're coming into, we are in the middle of July, and we are coming into open enrollment. And open enrollment is the period of time where Medicare beneficiaries can change their coverage, meaning they can switch from original Medicare to a Medicare Advantage plan, or they can add a Part D plan if they haven't done so. And one of the things that I'm doing in the county is presenting on this, because a lot of people think that enrollment in Medicare you can do anytime, and you can change anything you want whenever you want. And maybe if that was the case, we wouldn't be here as HICAP, but the fact is that you cannot do that. And that's why all these nuances are very confusing for people. So beginning October 15th, people in Original Medicare can, if they want to, switch to a Medicare Advantage plan. When they do that, they are disenrolling from their current plan, whether it's a Part D drug plan and or a Medigap. They're dropping that and they are going into a network-based system. Vice versa, if they're starting in Medicare Advantage and they're going to Original Medicare, they not only have to do that, but they have to think about a Part D plan, which is a standalone drug plan that has an extra premium, extra co-payments, co-insurance, all of that. And they can do a Medigap if they want. One of the things that people don't realize is when they switch from that one side to the other, they are literally disenrolling from what they had. And some people now in this generation, they've been with Medicare for maybe 20 years. They have a very strong Medigap policy, and it's called an F plan. The F plan is covers everything. It covers everything. And it's the plan that everybody wanted back then, 20 years ago, and they still want it. The problem is you can't get it anymore. But you can keep it if you have it. We've had people during open enrollment be targeted by people in Medicare Advantage plans who wanted to switch them out from that to go to a Medicare Advantage plan so that their enrollments can be boosted and they get bonuses. So that person that is targeted doesn't understand what they're doing. They say, oh, great, I want to change my plan. I'm tired of paying that huge premium, $400 a month or whatever it is, forgetting, not knowing that when they cancel, when they move to another plan, they are disenrolling from that, and that means they cannot go back to it. They're going to drop it, and it's going to be gone. Now, that F plan, I'll just give you an idea of what it covers. It covered everything that is on this list. Everything. Medicare Part A coinsurance, Part B coinsurance, blood, Part A hospice care, skilled nursing care. Now, skilled nursing care, you can pay a lot of money for that. Medicare Part A hospital deductible, which right now is $1,676 per benefit period. That's not annual, that's not monthly, that's per benefit period. That can be several times a year if you are going in and out of the hospital. Medicare Part B deductible, Medicare Part B excess charges, which is the 15% extra that some providers charge. Foreign travel emergency. Most of them don't cover that anymore. So there is an out-of-pocket limit for these, but the fact is that you cannot get an F plan anymore. Our next best right now is the G plan. That's our Cadillac plan right now. That one covers everything but the Medicare Part B deductible, which right now is $257. And that goes up a little bit each year. But annual open enrollment is a time when if you're going to change something, make sure you know what you're changing and make sure it's your choice and that you're informed about it. So we're here to help you understand that. The other thing is that people forget that they need a drug plan. And if they didn't enroll in one when they should have, and they don't have a special enrollment period for them, then they need to do it during this period of time, October 15 to December 7. And it becomes effective January 1st. If they don't do it then they have to wait until the next year. And every month that you delay, you're accruing a penalty. It's 1% for every month that you went without coverage and you didn't have it and you didn't elect to get it. So it's an important time of year. And the problem with it too is that people's, especially with drug plans, their coverage needs change, their prescriptions change, pharmacies come in and out of network. Everything has a price to it. And the plans that are offered are going to change as well. So your plan that works right now might work, but it might not. And you don't know it if you don't check it. If you don't put your prescriptions into what we call Medicare.gov and find out what plans will cover those drugs and to what extent, you're not going to know until January 1st when you go to your pharmacy that your plan isn't accepting that prescription anymore. And then by then, it's too late. So one of the things we also recommend is that you contact us to get your prescriptions into the portal, and we come back with the plans that are best for you. And again, it's your choice, but we give you the facts so that you can understand what you're choosing. Everyone's health can change quickly. Prescriptions change, they drop off, some come on board, and unless you're on top of it, you can be blindsided in January finding out that you actually don't have coverage. We've had people that have lost their Part D and they didn't even know they lost it. And then they're without it, and they don't have any drug coverage at all. And they've got chronic illness, they've got diabetes or COPD or something. And it's important to really know that you have a lot more to protect with Medicare than most people realize. So I'm just checking the chat. I'm trying to keep my voice going. How much time do I have, Tina?
Actually, we're supposed to end, but if you have any questions.
Oh, I am.
Yeah,
You're right.
2:45. So thank you so much.
Okay, well, let me do this.
Yep.
I have
your contact.
I can't share my screen, but I will put in my contact information in the chat.
Great. Thank you
again,
so much, Virginia. Very informative.
If I can send it to you. Oh, hold on. I meant to send this. Okay, so let me do this. I'll send my email and phone number. And I'm happy to share my slides with you. And I'm so appreciative, Tina. Thank you. And I don't know if I want to watch my recording, but if I did, where would I find that?
I'll let you know. I'll send you the link.
Okay.
Thank you so much. Appreciate it.
Thank you so much, everyone. Thanks for your patience.
Take care. Bye-bye.
Okay. Bye-bye.